Joining us now is Dr. Milton Leon. How are you doing this afternoon?
Good. Thank you very much for the invitation.
Thank you for joining us here on the show. Now, Dr. Leon, you are actually at a new location in San Angelo. It's the Cardiovascular Center of Excellence. Explain kind of what this center is and what you're all about.
That's true. The Center of Excellence is an outpatient facility when we can perform endovascular procedures for patients who have peripheral arterial disease. Peripheral disease is a condition characterized by development of plaque in the arteries that provide blood flow to the lower extremities. So if the plaque is severe, that develops, patients develop pain, aching, heaviness, numbness of the legs and the feet. And if the plaque becomes more significant, that can lead to ulcerations that don't heal. And eventually, if not recognized and treated, can lead to an amputation.
So who are, I know there are some patients, right, that are at risk more than others, right?
That is true. Patients at risk for PAD are patients with diabetes, hyperlipidemia, hypertension, and patients with family history of coronary disease or PAD. And these are the patients who are at risk to develop this significant medical condition.
Now, there are some warning signs, right, that can indicate that you might be suffering from PAD. What are some of those signs?
The most common signs of symptoms of PAD are aching of the legs, primarily upon walking. Also, people experience a heaviness of the legs, restless leg syndrome. Some people have leg swelling too. And eventually, people develop ulcerations that don't heal. So any patient who has an ulceration at the foot or at the leg, which lasts for a long time, more than a couple of weeks, they need to be checked to see if they have significant PAD. It may lead to this condition. And,
like you said, they need to be checked. How do they need to go about that, about getting those checks?
It is checked very easily in our facility and in our office with a non-invasive test, and takes about 15 to 20 minutes. We check the blood pressure in the arms and the lower extremities, and we compare the blood pressure of the lower extremities with the pressure to the arms. Usually is equal. If the pressure drops to the lower extremities, it's indication of poor blood flow to the legs from peripheral arterial disease.
And so the cool thing is that they can go to your office to get checked, get diagnosed for that. You guys are actually the only outpatient cath lab here in San Angelo, which is very interesting. Very cool.
That is true. We decided to open this facility because it provides several advantages having the procedure in our office, in our facility, compared to an inpatient facility. First of all, we provide personalized care. We have one-to-one patient ratio, so it is, the care is very personalized and the patients are extremely satisfied. The second is very convenient for the patient. They just park outside the office, they walk in and have the procedure done, and they're discharged in less than 4 hours of procedure. Also, this is not a hospital, it's an outpatient facility, so we don't treat acutely inpatient, so the risk of getting a hospital-acquired infection is zero because it's not a hospital facility. And finally, and what's also important for the patients to know is that the cost of the procedure to be done in our outpatient independent facility could be significantly less, up to 50% less, if that procedure was performed in an inpatient facility.
And so you've been open for, is it about 2 months now?
We're open almost 2.5 months, that is correct.
Have you had a good response from the public?
That is true. Several patients had a procedure in our facility and they're extremely satisfied with their care and the results. And as I mentioned earlier, they're discharged within a few hours, and which result is significant improvement in their lifestyle and their symptoms.
Well, that's wonderful. Now, once again, everyone, if you or anyone you know thinks they may be suffering from PAD, you can go get checked at the San Angelo Cardiovascular Center of Excellence. That is located at 3180 Executive Drive, Suite 102. Their phone number is right there on your screen, 325-999-1212. And again, they are open from Monday through Friday, 9 a.m. to 5 in the afternoon. This is the only outpatient cath lab in San Angelo. It offers great benefits, as Dr. Leon was mentioning. So go ahead and check that out for sure. Thank you so much, Dr. Leon, for joining us here on the show.
Amanda, thank you for your time.
Absolutely. We'll be back with more right after this.